Good day, everyone. So welcome to this webinar. Let's wait 1 minute since we are seeing other people joining, and then we will start. Okay, so I think that we can start while, people are still joining. Well, welcome to these webinars. And this is the last of the first series that we are conducting on the One Health Priority Research Agenda for Antimicrobial Resistance. This webinar today will focus on the last pillar, on the more specifically economics and policy. And we have a different panelist that will help us to tackle the topic and the different research questions that were considered and included in this pillar. My name is Francesca Latronico. I'm working at the Food and Agriculture Organization of the United Nations, and I'm here together with a colleague from the quadripartite. This activity indeed has been a joint exercise of the quadripartite with the support of different experts around the world. So I'm passing the word for my colleague. So first the World Health Organization, so the colleague from Jorge. So over to you to introduce yourself.
Thank you, Francesca. Good day, everyone, and thank you for joining. I'm Jorge Mateo from the AMR division in WHO. Over to you, Elizabeth.
Yeah, thank you very much. I'm Elizabeth Erlacher-Wendel from the World Organization for Animal Health, for all the ones known as OIE, and I'm now a senior advisor for antimicrobial resistance to the organization, while was the head of the Department of Antimicrobial Resistance and Veterinary Products before.
Thank you very much. And then, unfortunately, the colleague from the UN Environment Program could not join because for other commitment. So just some reminder regarding the etiquette for this webinar. Please keep your microphone on mute so we can hear very well like the speakers. Rename yourself with your organization and country, followed by your name and surname so we can easily understand where do you come from. Then please note that the views presented are those of the speakers, and then refrain from advertise any services or your company or any commercial product and brand. As we will have the panelist discussion, please also write your question in the chat after that they finish to discuss, and we will aim to answer all of them during the Q&A session, which is dedicated for it. Just as a reminder, so this meeting is being recorded, and the video and also the PowerPoint will be posted in the quadripartite Joint Secretariat AMR website, which you can see also here. So and now, without waiting anymore, so I'm giving the floor to my colleague Elizabeth for giving the presentation on the specific pillar. Over to you, Elizabeth.
Thank you very much, Francesca. So, as you told, it's the last one of our first series of webinars, and it's the last pillar here on economics and policy. We are on economics and policy. We had already made the transmission integrated surveillance, intervention and behavior, insight and change. And you see that you can access to the agenda on the link. We have it here and we have it on several slides. So we have now a quadripartite website, and that's really nice because you find all what we do together there. And that's the direct link here that is on the slide. The outline of my presentation will be that I will start with a bit of historical background, reprecise aim and scope, then go to the details of the top priorities that were the results of the exercise on economics and policy, and then very briefly mention the methodology and speak about the next steps. The starting point, some of you have already known this or heard this, but I think it's still important to remind that we have a definition from the One Health panel since 2021. And that means that One Health is recognized that an integrated, unifying approach aims to sustainably balance the optimize of the health of people, animals, and ecosystems. It also recognizes the health of human, domestic, and wild animals, plants, and the wider environment are closely linked and interdependent. And it means that multiple sectors, disciplines, and communities should work together and contribute to sustainable development. You have the full text here. So we're not coming from nowhere. I mean, not only the quadripartite, we don't want to highlight this again, but we really work together now for many years. And maybe as a starting point, we can speak about the Global Action Plan that was published in 2015 that already mentioned not only that we should work together, but also that research is needed. The second milestone was the Interagency Coordination Group report that came from April 2019. And you know that this was really the political level recognition of the need to do something and to do something together. This research agenda is embedded in other work of the quadripartite organizations. And that's what we call the quadripartite strategic framework that was published in 2022. So that means this is part of a bigger picture, but this is for the first time a part that really looks on research on One Health. What is the aim of this agenda? It's to catalyze the interest among researchers and donors on this One Health aspect of AMR, provide direction for investment in this area, and we would like to focus on low and middle income countries, and also to identify and prioritize the research areas at the interface again between One Health sectors that will inform policy and practice relevant evidence. We have the word policy here. That's the aim of our webinar today. What do we not cover? First of all, it's a global exercise. It's again the interface, but that does not mean that we don't think it's important that each sector has to do its homework. But this work focuses on the interface. We have included antimicrobial resistance microorganisms with focus on bacteria, parasites, and fungi. And we have embedded this work in the time frame when we started 2022 to 2030, the SDG frame. What is not included in this work is research and development of new antibiotics, antimicrobials, or vaccines, the diagnostic development, and for sure the research that is related to one sector. So this is a slide that you will see again, because I want to focus here on the global time frame. So the starting point was in January 2022. And the first part of the work was really to determine the research areas by literature review, a global open survey, and expert input. This prepared a second round of expert implications. That means the Delphi process that I will give some more details later on. And the end product of this is the official report of our agenda. And since last year, 2023, we started with the webinars. This is our first series. We very much hope we will have a second one. And that's the last of the first series that we are presenting today. So now I'm coming to the detailed results of economics and policy. The focus of this pillar was investment and action in antimicrobial resistance prevention and control, and again from a One Health perspective. This includes policy, governance, legislative and regulatory instruments, cross-sector processes and strategies, but also joint planning and policy goals among ministries. I think we will speak about this in the discussion, but also cost effectiveness, financial sustainability, and long-term financial impact. We have keywords here, sustainability and long-term. I think that's also an issue. So what was the outcome of this? We had 10 research areas that were identified by the experts, and they are presented in 3 categories: methodology development, operational research, and evaluation. We have created these categories to also give a bit of a guidance and timelines, because if you don't have a methodology, it might be a bit more difficult to use the operational research. And that's what we see very much today. We have a lot of research, but we can't really use or compare them, this work, because we don't have a common methodology. And for sure, evaluation at the end, that's something to follow up. So I'm going to the details. You have this for sure in the agenda. So the first, from the methodology development, we have first of the questions that have been identified as a priority. The first one is, what would One Health AMR socioeconomic impact assessment based on accurate and cost-effectively collected data in low-resource settings optimally look like? You see the questions are quite long, but I think that also reflects the discussion we had with the expert. The second one is, how can governments identify priorities and institutionalize the most relevant cross-cutting sector-specific AMR policy options, regulatory frameworks and financial strategies to sustainably tackle AMR across One Health sectors, given the different implementation challenges? That's too much. So then, what innovative, either new adapted methods that lead to actions are needed for the evaluation of AMR prevention and control across One Health sectors in low and middle income countries, with a focus on low cost, high quality, high reliability policy relevance? I think there's a lot of wishes here. And then the next one is, what is the optimal financial resource strategy that will sustain support for One Health AMR intervention? And the last one in the methodology development is, what would a harmonized conceptual framework, method and key indicators that systematically include equity considerations in the One Health policy optimally look like? Equity, I don't know if you have seen, equity is a cross-cutting point in all the work that we are doing. So in the operational research, again, we have here 3 questions. How can operational and implementation research systematically capture learning from antimicrobial resistance national action plans implementation practice and serve as the basis for improvement at the country, regional and global level? For instance, identification and development of impactful policies and legislation. So I think this is coming again for the panelists. So you will see these questions coming addressed by the panelists. The next one is, how can appropriate and acceptable antimicrobial use and antimicrobial resistance reduction indicators or targets for national governments or sectors be developed, reached and reported? Again, a question you will see for the panelists. What impacts can national and subnational policies have on antimicrobial resistance prevention, control and response across One Health sectors, and how should they be measured? So now we're coming to the evaluations. We have 2 questions here on the evaluation side. What lessons and synergies for antimicrobial resistance reduction can be learned and leveraged from other policy initiatives? As an example, we had climate change, fisheries management, to tackle collective action problems. And the last one that came up as the result of the discussions was, how should governments incentivize and drive material and immaterial innovation into solutions to antimicrobial resistance in areas where the profit motive is currently insufficient? So that are the questions that you will find also in the as an outcome of the result of all the process. And now we'll give some words on the process to highlight how we came to these results. We are here in the last pillar, and you see on the right side of each pillar how many questions we got, how many answers, priorities we have finally retained in the results. It started with 62 priority research areas, and in economics and policy, we had 10 that were retained. There is a whole annex on the methodology that you can find at the second part of the agenda. And I would also come back on the gender vulnerable populations and sustainability, that were cross-cutting points that we have addressed in all of the work. Now, again, to this slide, but now I will give a bit of more detail how we came to this. Again, we started with an academic scoping review. That was done in the very first start in January 2020 and December 2021. Then these questions were opened. There was a global survey that was open to stakeholders and all kind of participants that were interested. And we had 1,620. This happened from July to September 2021. After this, we also had a grey literature review and survey analysis. So to come up then to the panel, which were done with 89 experts, that helped us to shape these results and shape this agenda between May and August 2022. The expert discussions after the panel, the first round of results we had, we again discussed pillar by pillar with the experts to come up with the final result that I just detailed. And the report was published in 2023. We started with 154 research questions across the pillars, and for the experts had to use five criteria, which were: is the research important? That was the first one, and that we dropped in the second round. So the first round had: is the research important? Will the research strengthen research capacity? Will the research be inclusive? Will the research be impactful? And also, will the research be actionable in low and resource settings? So these same criteria were used in each round, except the first one is research important. So for this pillar, we had not always the same number of experts that were participating in each of the rounds. We had 13 experts of the 17 that were retained for this pillar. We had 24 research questions. We started with 24 research questions. And again, each question rated against the criteria that I did just before. But there could also be suggestions of up to 2 new research questions relevant to the pillar. The second round started with, had 11 experts. And again, we had 24 research questions, but not the same. And each question rated again against the criteria, the 4. Again, importance was taken away after the second round. Then we had 14 experts from in the last round. We came up with 15 research questions to be discussed, and we asked them to select the top 10 per pillar. And that's according to the 4 criteria again. But we did not ask them for a ranking of which one was the most important within the 10. We just asked them to let the most important 10 in. And that's more or less the result, because we also had we have the economics and pillar. We had a lot of discussions. So we have in the discussion after the Delphi process, we have merged some of the questions and added some. So the final results is the 10 agreed priority areas. And we have introduced what I told these categories to provide a bit more guidance and sequence and the potential impacts of each of these steps. And then was very interesting because this pillar, together with the behavior insight and change pillar, had the lowest level of consensus and the most discussions to come up with to reach a final agreement on the results. So here we are now. We have the results. We tried to do already awareness on the global level. That's what we're doing here on the research agenda. But we also would like to go to more regional awareness, not only for the timing. Some of you might be very early or very late. We will try to adapt our timing. And this will then have to be adapted to the national needs as national research agendas. We aim for donor engagement and expert engagement. That's what I try to do. And for sure, the scientific community. And in the second step, in the future, we also would like to go to more regional donors and quadripartite regional offices. That's the aim for the future. And then once we are there, we go to the national level. Again, what we try to really create is interdisciplinary and multi-sectoral research networks. We really are convinced that we have to work together, and that's also very much done by people that want to work together and that understand each other. And we'll also involve our collaborating and reference centers here and the research community. I hope many of you are here listening to the webinar today. That is where we are. And our last announcement that we were very proud took a bit of time. The research agenda that was so far available in English is now available also in French and Spanish. And again, we have the link down here so that you can directly link to these research agendas. Jorge, I don't know if we have already the French and the Spanish one on the website, but if it's not yet there, we'll follow very soon. We also would like to thank you in the name of our colleagues that are here and also UNEP. And again, we have the Quadripartite website where you can find all the work we do together. If you want to go to research agenda from the general website, please click on technical work, and then you will find here several documents and the One Health priority research agenda for AMR. And with this, I hand over to Francesca.
Thank you very much, Elizabeth. And then now is the time to listen from the different experts, so the panelists, and it will be Jorge that will lead this session. So Jorge, over to you.
Thank you. Thank you very much, Francesca, and thank you, Elizabeth, for presenting these findings that we have for this pillar. I'm going to moderate this panel, and we have 4 experts that were part of this development of this research agenda. They have extensive experience on economics and policy and AMR. So welcome all of you, and thank you for sharing your thoughts about this and experience. I will start with Dr. Mirfin Pundu, and I will introduce himself now. Dr. Mirfin Pundu is the director of REACT Africa and a member of REACT Global Leadership Team. He provides countries with technical assistance on national action plans development and implementation, including regional bodies, and works closely with the quadripartite organizations and regional economic communities. His expertise of over 20 years includes pharmaceutical supply chain management, infection diseases, and antimicrobial resistance, global health security, global One Health, international health policy, and diplomacy. Thank you, Dr. Mirfin, to join us. Based on this, your experience, Dr. Pundu, the question for you is, based on your work on low and middle income countries and the need for context-specific research to inform effective One Health AMR intervention, would you consider it important to systematically include such research in the national action plans on AMR? Over to you.
Thank you so much, and a huge congratulations. It is great to see this work, and having been part of the group, I think it's really phenomenal. I'll just take a step back. I think one of the challenges that we had following the passage of the Global Action Plan, when we started supporting countries in 2015 through 2017 and moving forward, was the challenge that there wasn't any local data that was informed by research that could be that was going to be used in informing the situation analysis that we conducted. We were very involved from the very start, from zero, in supporting the development of well over 15 national action plans in the African region. Data wasn't available, and so most of the plans that were developed were devoid of data that was evidence-based, that could be used across sectors. And One Health, frankly, was like a new term that had come in, and there was so much confusion. It was interpreted in different ways in different settings. So we had the first research prioritization exercise in 2018 that was funded by CEDA, where we brought researchers, policymakers across sectors to identify the priority areas in the African region, most of which and we went through the process that has been well elaborated here. It was a similar process with very minor differences. It is important to really look at this for key reasons. One is that our contextual relevance is very important. Every region has distinct socioeconomic, environment, and cultural factors that influence how AMR is managed. Context-specific research ensures that interventions are tailored to these local nuances, which can significantly enhance their effectiveness. Secondly, informed decision making. Policies and strategies informed by local data are more likely to address the actual challenges that are faced by healthcare systems, by the food systems, but also in the environmental sector. This leads to a more pragmatic and sustainable AMR interventions. One health approach is thirdly very key, as AMR, we all know sitting here how complex it is, how we get it is, how it spans human, animal, and environmental health. And so being very context against specific research supports the One Health and understanding, how AMR integrates in these different sectors. The drivers are very, very key. But that has to be something that is at country level, at a region level. Our surveillance and monitoring are very key because local research can help improve surveillance systems by identifying region-specific pathogens or concerns and resistant patterns. It would open up areas around capacity building. How do we build capacity? How do we integrate what we are finding out in research into national action plans, into areas that needs actually strengthening? The point of equity and access is really key because, we need to tailor our research and interventions to local needs to help address these inequalities that we see, and the fact that we know that AMR affects disproportionately folks depending on, whether, on health literacy levels, on, access to issues around WASH, issues around IPC infrastructure, etc. And also, I think the global impact, effective management of AMR in LMCs also contributes to global health security, local research. Unfortunately, what is the practice is that most of the research that is done by donors, by education institutions coming from the global north, happens in the low and middle income countries. That research is barely known, or the results of that rarely known by policymakers or by countries to be able to use it. It is published in journals. Folks get their master's, their doctoral degrees, postdoctoral degrees on really data that was collected, which never ends up in those countries to guide our policy making decisions. So these are critical elements that I think out open these conversations with as we begin our dialogue this morning, this afternoon, or morning, wherever you are on the globe. Thank you.
Thank you very much. This is really, really important what you are highlighting here. First, it's true that, in fact, this research agenda is focused, as you see, in the low and middle income countries, exactly because data is missing in low and middle income countries. We need specifically more research on this context, as you mentioned, at regional, but also at country level, because I fully agree that the regional context is also different. So it's also important to be considered. And also really important what you mentioned about all this research that we are seeing in low and middle income countries, but unfortunately, this is not translated in actions at national level. And that's why we are trying to disseminate in this research agenda to attract this collaboration between the research institutions in high-income countries that are already conducting some research and link with the needs at country level to really have some impact at the end, these findings at local level. Thank you, Mirfin. I will move to the second panelist. We have Rosa Peran-Sala. She's a specialist advisor and coordinator AMR International at the Ministry of Health, Welfare, and Sport of the Netherlands. Rosa started her career in Spain and moved to the Netherlands to work for the Food and Consumer Product Safety Authority. She has also worked at the European Commission, coordinating the first EU action plan against AMR, and at the European Medicine Agency. Rosa is a doctor in veterinary medicine, graduated as an agricultural engineer, and holds a master's degree in science and food technology. She is a postdoctoral degree in veterinary public health. Welcome to this webinar, Rosa, and thank you for sharing your thoughts and experience. We know that you have extensive work on in this Codex Task Force on AMR, where it's really important to discuss how to create and develop guidelines, Codex guidelines, and how to find this consensus. So the question for you is, based on this experience, what are the key elements that you consider to reach a consensus between sectors regarding policy options to control AMR? Over to you.
Thank you very much, Jorge, and thank you, the quadripartite, first of all, for inviting me to this webinar. And I think that thanks for the question. And but let me start maybe briefly explaining for the ones that are not familiar with Codex Alimentarius, what is Codex, and especially the task of this, the work of this task force, because I think that Codex is a good example of this. How different sectors are working together to reach consensus. So Codex is a UN international food standard organization, and the WHO, the World Health Organization, and the FAO, the Food Agricultural Office Organization of the UN, joined established this program already in 1963. So it's more than 60 years already. So WHO empowered the parent organizations of Codex Alimentarius. And Codex develops and adopts food standards that are applicable to all members of Codex Alimentarius. And the members of Codex Alimentarius are at this moment 190 member countries. So almost all the world is working on Codex Alimentarius. But Codex also has observers, and that is, I think, very important because it's the involvement of stakeholders. And in this context, also UNEP and BOA, the other members of the quadripartite, are observers and involved directly in the work of Codex, altogether with also other 16 UN organizations, NGOs, etc., etc. And but focusing what are the objectives of Codex? Codex has two main objectives. The first one is to protect consumers' health, and I will say this is the part that maybe is most relevant for WHO work. And the second is facilitate trade or avoid barriers to trade. So to ensure that fair practices in international food trade are met. And these two objectives sometimes are a little bit controversial and may create difficulties, especially because the second one is directly affecting economics and has directly implications for the different sectors involved in the work of Codex. Also important to mention that Codex is a science-based organization, and that in the independent experts and specialists of different disciplines contribute to the work of Codex. But from the other side, representative of policymakers of member states are also members. So this is also a point to have into consideration. And then that important is that Codex is adopted, the Codex standards are adopted by consensus, which means that everybody has to agree. And that sometimes has also implications on the level of ambition of that Codex can reach. And really important also, as I mentioned, these economical implications, because Codex standards are referenced for the dispute settlement mechanism of the World Trade Organization. Codex standards serves a reference for the international food trade. So having said that, and going back to your question about the key elements to reach consensus between sectors regarding policy options, I think that Codex, and especially the work of the Task Force of Codex Alimentarius, which was to draft code of practice to contain and minimize antimicrobial resistance, and the guidelines for integrated surveillance of antimicrobial resistance are a good example that demonstrate that even all these discrepancies and between sectors, between countries, building consensus is possible in such a complex topic. This consensus, as I said, is between sectors, but also between countries. And here you have the huge difference between low middle income countries, high income countries, and also between, in this case, for Codex, import-export countries. So there are lots of points of discrepancies between them. But I think if we go to the key elements that were key to reach the global consensus, I think that one important was that we had clear understanding of the complexity of the topic. We recognize that there are still knowledge gaps, but that prompt action is also needed so that the cost of inaction is an acceptable height. So going to these gaps, for example, the relationship of the use of antimicrobials in food-producing animals and the emergence of AMR in the food chain is a concern, and not all is resolved. We have a lot of questions on it. Also, food production practices plays a role and can contribute to this emergence of and the spread of antimicrobial resistance in agricultural production and the potential routes of exposure to humans, but we have still lots of questions on it. Also, to which extent the use of antimicrobials in food animals, aquaculture, horticulture, or humans contributes to AMR in humans is also different, and we cannot have an answer still for it. So AMR has food safety, food security, and also economical implications, and all these together make it complex. But despite all these all these concerns and still knowledge gaps, as I said, we recognize that fighting AMR requires prompt action and One Health action from all sectors, because all sectors are involved. All sectors are part of the problem or contributes to the problem, but at the same side are needed and are part of the global solutions. So that all sectors have this own responsibility and have to contribute to it, and that I think was key on the work of Codex. And another important point to reach this consensus is engaging the different stakeholders. As I said, the work of Codex is mostly guided by policymakers, but there are also representation from industry, healthcare professionals, civil society, all different, and experts, academia, etc., etc. All of them are represented as observers and can contribute to the work of Codex. So I will to emphasize this importance of this multi-sectorial collaboration in addressing AMR, and that all stakeholders need to be involved. And another key element that I think that is important is that we need clear objectives and we need clear goals, but we need also flexibility, because we have to take in this context national priorities, capacities, the the needs are different. And Codex in this context, but when we are speaking about with the research agenda and what is needed, we need to ensure that we provide guidance and harmonizations, but that we allow progress also according to the specific needs, infrastructures, technical capacity, capability, and resources, and also that new scientific knowledge is something that is needed all the time. So just to finish, another important point that I think that we need to mention, and probably we'll cover later, is that financial and technical support for sustainability, for sustainable practices are also needed. Thank you.
Thank you very much, Rosa. This is really important, and thank you for the overview about the Codex work. I know that it's really complex, and we are talking here about a lot of complexities, but the main message here that you have shared with us is that, and I am taking this, that the awareness and also building consensus is possible, even with the different gaps and complexity that we can identify. This was interesting because you were in this work that is multi-country work, but also is important at national level. So this can be also translated at national level. But you also highlighted the importance of the awareness that everyone participating in this multi-sectoral work, One Health work, should be with clear objectives to address AMR. So they need to be clear that it's needed to make action on AMR, and that's why the coordination and work together is key for this. Thank you very much, Rosa. I will move now with Joy Ellis Iversen. She works as a special advisor to the Danish government. She's a veterinary epidemiologist who has been involved with One Health on the science policy interface during her whole career. She has been a member of many expert groups and advised several governments and supranational organizations on AMR control and One Health collaboration. Thank you very much, Joy, to join us and share your experience. I think that your experience to work on this, to put in place all this One Health, is really, really important for this discussion. In your opinion, what can be done better to ensure that AMR research addresses One Health aspects in addition to sector-specific research? Over to you, Joy.
Sorry, I'll just unmute myself.
That's fine.
Thank you very much for the opportunity to join you here and explain some of my inputs to this very important work that quadripartite is doing. I've worked with a lot of different countries on One Health and AMR, or AMR, and in different aspects, and I've worked both with the science community but also with governments or with private industry bodies who also have policies. And one of the things that I often notice is that where One Health may be implemented at one level, it may not sort of be implemented at different levels, and therefore all the good intentions at one level break down when you start putting it out in other places. And to put it in the context of research, what we often see is that funding bodies or government departments that have the research money and want the research done are often siloed into either health or animal health or environment and climate change, and fail to speak together. So when they set out a research call, they reach the usual people that they normally put out a research call for, because they don't have the tradition of collaboration, and thereby you get siloed research as well, or you get what some of the things that we see now that One Health is a real buzzword out there. People have really good intentions, is that one agency or one sector may suddenly decide to do One Health on their own, but that sort of defeats the purpose of One Health, because One Health is about collaboration. It's about using all the expertise, all the needs, looking at everything across all the sectors, and then making the best choices or the best research or the best tackling the biggest problems. And I think that's sort of my message here is if we want more true One Health research, we need to work at all levels, at government levels, at funding body level, at researchers level, and at government level especially, in a One Health way. We need to meet up regularly to speak together. We need to have collaboration. So it's a natural way of thinking, especially when we're thinking AMR, which is no doubt one of the biggest One Health problems we have, or after COVID, maybe the second biggest. But it is an essential area to have these collaborations. And if we don't normally talk together about other problems that are cross-sectoral, we forget it when we get to the research funding and the research allocation. So I think that's my message, that we need to establish these links at all levels of research.
Thank you very much, Joy. And I think that I fully agree with you. It's important how we have, even when we have research at country level, sometimes it's sector specific, or they are not linking what they are doing with other sectors. And exactly what your message is saying is that we need to work together. This is the One Health's most important part, how to build this multi-sectoral collaboration. And it's really good because there are very good work that has been conducted on One Health that is working and is providing this knowledge that we need. So this is also the opportunity. Thank you for your thoughts and experience. I will move now with Gada Subian.
Oh, I'm sorry. I was hoping to speak a little bit about the needs for policy research as well. The needs that policy have to actually help fight AMR, because we have a lot of scientific research out there, and also, as you mentioned, very, very good One Health scientific research. And I think that's extremely important. But when you talk about policy research and you want One Health into policy, we need tools that can prioritize where to intervene, looking across all sectors, finding out for a country-specific needs, whether it's more important to tackle AMR in private infectious wards in hospitals or in shrimp farms. But we need to look across. We can't just put all the money into cattle farms and none into pediatric wards where the problem may be bigger. So I think that's one of the things we need from research, is actually some tools to help us prioritize across the sectors. When you do policy, you also want to know something about where intervention is most needed in your country. Not necessarily where most researchers have looked, but where is it actually needed? And for this type, we need some social science studies to map out the social needs of the country. Where is the support best given out to give most benefit to the country? And another thing we look at a lot is where would it have the biggest impact? And here we have scientific models that can show us if you reduce antimicrobial resistance in this sector, it will give the biggest impact to the other sectors as well, which is really good. But in policy, we also want to implement and spend the limited resources we all have where we're most likely to be successful. So even though our scientific model says it's most effective to do something here, if the people in that sector won't work with us, it's not going to be very successful, because whatever intentions we have will not be implemented or applied in a large scale. So here we need some scientists who can help us do some stakeholder analysis as well and find out where do we get the biggest benefits from working with what people. So that even though it may scientifically give a less benefit of controlling antimicrobial use here or here, because the people are happy to work with us, we will still end up with a bigger benefit. And I think that's some of the things that are really important when you talk research for policy, that you need to go beyond the natural sciences. You need to bring in all these different perspectives, because that's what policymakers are fighting every day. We're considering this, that, and the other, and we need knowledge in different areas to help us make the best decisions.
Thank you, Joy. Yes, this is really important, because we talk here about multi-sectoral work. And we are just talking about the work that is needed for each sector, but it's true that additional to this multi-sectoral work is needed to the government be involved, but also other disciplines. And you mentioned something that is now critical, especially for AMR in all sectors, and especially for One Health, it's the social sciences. How social sciences is really linking all this work and can also show some impact that is really coming from research. So I fully agree that this discussion should be, it's important. It's really important not just to think about the aspects of each sector, but what this research agenda is bringing is what is needed at the interface. And this interface need to work together, not only by sector, I mean, the 3 or 4 sectors, but also other disciplines that are needed to understand what is the problem and what will be the best intervention to impact all this work. Thank you very much, Joy. I will move to Gada. Dr. Gada Subian has 20 years of experience in leading and executing research strategies at national and international level. As an independent consultant for the International Center for Antimicrobial Resistant Solution, ICARS, Gada develops partnership with a wide range of stakeholders, including potential donors, UN bodies, NGOs, and the private sector. Gada holds a PhD in biology from the University of Manchester, and she has served as a science and innovation lead on AMR and public health in different organizations, such as Wellcome and the UK Medical Research Council. Welcome, Gada, and thank you for joining to this webinar and share your experience. The question for you is that based on all this long experience that you have, how can the link between policymakers, governments, and the research community be strengthened to support the implementation of this AMR One Health Priority Research Agenda? Over to you, Gada.
Thank you very much, and thank you for inviting me and ICARS to be part of this webinar, and congratulations to the quadripartite for the very much needed research agenda. And this is really a very tricky question, and I'm following up from the previous speaker who flagged rightfully all the issues to bridge the science policy interface. And it's an issue that is not only witnessed in low middle income countries, even high income countries still struggle with that notion of innovative research that has progressed and may or may not align with the priority of the country and may or may not be translated to what policy need is. And I think it's within that context, really, that ICARS was born. And if I may reflect a little bit, the International Center for AMR Solution, which was created very much with the view of bridging the gap between science and policy and practice. And it is very much within that we try to introduce over the last 3 years a new model for this interaction, where we call it a top-down, bottom-up approach, where a lot of the research priority is actually introduced by ministries and AMR coordinating committee aligned to the national action plan of the countries. And bottom up, because we have the research community, the NGOs, the civil society, and the end user really doing the implementation and the shaping up of that. And it's at that junction between top down and bottom up that actually you start bringing those agenda and stakeholder together. And what ICARS does in this setting is very much provide the technical expertise and walk the path of that development of these projects, but as well the funding. And those topics that are chosen by the ministries and the research organization, by that consortium, are really priorities set by the country rather than ICARS, which I think is really something very important, where the problem and the solution is owned by that consortium. So we might need now to start thinking really seriously about transforming the way we support research so that it is not really categorized into scientific organization, research organization, and a policymaker. And very importantly, and flagged by the previous panelists, is really that all these research projects that are being shaped up should have behavioral science at the heart of it, should have economy at the heart of it, because unless really these solutions are value for money, it's going to be very difficult for countries, especially those countries with very limited resource setting, to be able to prioritize them. So again, those solutions that are suggested by the countries, aligned to the National Action Plan, informed by the research need, and that will be able to strengthen the science policy, research policy interface, but as well as strengthen the capacity and capability of the country. Now, of course, we can move a little bit further in the discussion to see how the role of the donors and the funder can play in this one. But I think really this is the critical gist of trying to shape up all of this. We have a lot of evidence out there that's already been either monosectorial or cross-sectorial, and those existing evidence as well that are by different funder, including funding organization where I have been in the past. I think there is a really need to look at that evidence and see how some of these evidence could be translated more closely. I know the quadripartite and others are trying to push for an independent evidence panel that will be looking at the evidence out there and seeing what really need to be pushed further. And I think bringing the policymaker, bringing the AMR coordinating committees within the countries at a country and regional level will be critical to really make an impact with what we already have funded. Thank you to you, George.
Thank you very much, Gada. You are wrapping all these aspects that were mentioned, and I fully agree. I think that we need also not just to see research as a source of evidence, but should be more rational. But exactly because we are talking about, I agree that it's not just technical work, but also how to gain this and convince the policymakers to really see this research as a source of information to impact in the containment of AMR. So thank you, Gada. I will move for the second round of questions, and I will move to Dr. Mirfin. Mirfin, another question is how you think that, how can operational and implementation research capture learning from AMR National Action Plan implementation practice and serve as the basis for improvement at country, regional, and global level? For instance, the identification and development of impactful policies and legislation. Over to you.
No, thank you so much. I think this is quite interesting. I think the foundation that has been laid, and this conversation has been quite illuminating. So when we're looking at really operational or implementational research or interventional research at at the local level to actually support and inform National Action Plan interventions and strategies, whether we are actually informing the policy development, or we are informing program development or practice itself. Those should be actually intersected. So at we can actually identify the unique challenges and successes of AMR interventions at the country level, and allowing for the adaptation of strategies again that fit the local context by evaluating the effectiveness and feasibility, as it were, of specific actions under AMR. This type of research would provide critical feedback that can then refine and improve the policies. For example, when one looks at India, implementation research might study the rollout of regulation restricting antibiotic use in livestock, for example. The findings can help then determine which local factors, economic, cultural, or infrastructure, that support or hinder compliance, leading to tailored adjustments in regulatory frameworks or targeted educational programs for farmers. At the regional level, harmonization of strategies and sharing best practices would be, as such an instrumental and very effective way of doing that. At the regional level, implementation research can facilitate the sharing of best practices and challenges across countries. This collective insight can lead to the harmonization of AMR strategies within regions, promoting consistency in regulation and practices, responding to outbreaks, pandemics, epidemics, that is, through the sharing of these and having the sentinel science, for example, in terms of surveillance. Here, for example, in the African region, one can look at Africa CDC that could initiate a program to harmonize AMR surveillance and control protocols among countries. This would involve standardization of data collection methods, sharing best practices, and facilitating policy alignment in antibiotic use. The program can also help to foster a really cohesive regional approach to AMR, enhancing the effectiveness of interventions and improving health outcomes by leveraging on shared knowledge and coordinated actions across the continent. At the global level, we could look at scaling up interventions and influencing global policies. Globally, operational research can scale up successful national and regional interventions by demonstrating their effectiveness across diverse settings. The research can influence international policies and guidelines. For example, global studies could compare the outcomes of AMR NAPs from various countries to identify universally effective interventions and barriers. And organizations like WHO, WOW, FAO, and UNEP as a quadripartite, can update with the inclusion of, UNICEF and other agencies, can identify, universally, effective interventions in that way. But there is also an area, lastly, where, identification and the development of impactful policies and legislation can be achieved through operational and implementation or interventional research directly contributing to the development of these policies. And so, even when re-evaluating effectiveness, studying the real-world impact of AMR policies helps identify the most effective measures which can be replicated or adapted by other regions or countries. Identification of gaps, research can uncover gaps in current AMR strategies, such as insufficient data sharing mechanisms, lack of enforcement instruments, and it can also work in addressing some of the issues we're dealing with now, like the pandemic instruments, or getting consensus at the global level. Testing of innovations, 7B key, but lastly, the engagement of a wide range of key stakeholders, because this is the spirit of One Health. This is the essence of trying to work on such a complex problem that cuts across sectors and has got lots of implication around other development agenda, like the Sustainable Development Goals, which are again, multi-sectoral in nature, but they contribute to the health of the environment, of humans, of animals, and ensuring planetary health also. Thank you.
Thank you, Mervyn. This is, I agree. There are some research activities and also share activities at global, regional level. Following question here, Mervyn. Do you have any example? Because, operational research activities have been conducted in some countries, in African countries, that do you have any example that these research activities at some specific country or countries that has been feeding the results of the first national action plan? Because most of the countries are now in the second phase, even some countries are in the third phase of national action plans. Do you have any examples that you can share with us about this? You are mute.
Absolutely. So you're absolutely right that, a number of countries are going through, either the midterm reviews, those countries that had national action plans that started in 2017, ending in 2027 or so. They are at the midpoint. Zambia is an example that I can give, where we were just working and supporting Zambia last year with the revision of midterm review. The midterm review, moving from last year into 2027 or so, is that it has been informed by a lot of local data. For example, we have collected, and the country has collected, to its credit, a lot of data on resistant patterns and pathogens through actually routine surveillance, but also directed treatment. And so we the data that has been collected is now feeding into stewardship programs, both in the human sector and in the animal sector, and the interventions on stewardship. And so you would find that there's the local context that we are seeing for resistance, say, towards, basic cephalosporins, as an example, is different than we are seeing, say, in Zimbabwe or in Nigeria. And so, yeah, we're starting to develop, we've developed guidelines that are very context specific and that follow the patterns of resistance in a country. When we look at the, multi-country studies that are feeding into National Action Plans 2.2 strategies, the tricyclic study for ESBLs. That is another study where pathogens are followed in the environment, in the human sector, and in the in the animal sector in terms of looking at E. coli. And there are a number of countries that are participating in that. There is Ghana, there is Zambia, there is Nigeria, there is Zimbabwe, South Africa. And so there is that hub of exchange of knowledge, and that and that is the sort of research outputs that are now informing the current strategies that these countries are taking. So these are practical examples that are quite critical. But I think earlier on I had I'd indicated probably I should have made a couple of examples where we can see that and Nepal, for example, it's a country with a significant population that relies on farming. And so, the research priorities there, might involve looking at how antibiotics are used in livestock and their impact, in the other sectors, but also, this would ensure that, those interventions are very context specific. Well, one looks at Brazil. I mean, Brazil has vast rainforest and diverse wildlife. And so research in these areas, might be able to look at, how genes move from the three, from the environment, getting, into human animal, and it could look at, some of these factors that are very context specific. So I think, there's a bright side, although, we may not see a lot of research happening, but, the few implementation opportunities that is happening currently, it's generating some data that, slowly countries are saying, you know what, we have to use local data. We have to use what we have. I've been to so many of these African countries where I've been told, can you help us have a national meeting where, we bring everybody who's doing research, because we don't know in the country who's doing research in terms of AMR. And so, they are saying, can you bring us all together? Can you just, we have one or two, everybody who's doing research, because we don't know. We read about these things out there, but nothing is being used locally. So I think, and I think it is important, again, I think for the quadripartite to, when we are supporting these programs at country level, to say, though we can say, report your data, for example, into WHO, GLAS, and whatever. The primary thing we should be telling countries where there has been a disconnect, that this data is not just for reporting. This data is for you to use, and there are few countries that have that understanding. The understanding, oh, we are reporting into GLAS, we are reporting to the Codex, we are reporting to FAO. But you ask them, are you using that data? Normally, they'll start, and they will be like, no, we are just reporting. So I think it is very critical that we are really saying, and we are helping how they can use that data in framing, and when we are supporting them with revisions of the NAP 2.0 or other national strategies or regional strategies. Thank you.
Thank you, Mervyn. Yeah. Thank you for sharing all of this. And I fully agree. And And this, I think, that is part of the second phase. And the point here is to how to this research agenda can contribute to identify these gaps that countries now analyzing the result of the first implementation of National Action Plan can fit for more accurate interventions. So thank you very much for the examples. And I agree that data should be, we also need to create the ownership by countries and not just to collect data. Okay, thank you very much. Rosa, the question for you is how you consider can appropriate and acceptable antimicrobial use or antimicrobial resistance reduction indicators or targets for national governments or sectors be developed, reached, and reported? Over to you.
Thank you for the question, Jorge. Yeah, actually, indicators are really important, are very valuable tools for policy purposes, because they allows us to assess national action plan, to track the progress made in the fight against antimicrobial resistance, and in some cases they also enable for benchmarking of and can help to highlight also best practices. So indicators are very, very valuable tools, but that means that we need to use the just indicators in an appropriate way. And developing these indicators is sometimes something that is difficult. I think it's very important to have these adequate indicators, because this will allow us also to align surveillance and develop the targets to reduce antimicrobial prevalence. But I said the challenge is how to establish these indicators and which ones you are going to establish. Because one of the challenges, I think, is first of all, agreement on criteria that we use to choose indicators. It seems a redundancy, but I think we don't have this yet, and that is an important question. Then the indicators also for the different sectors. We have, in this One Health approach, we have human, animals, plants and crops, that something are forgotten, and environment. And we need indicators that should be measurable in all these sectors, and that should be relevant for all these sectors. But at the end, we need to harmonize it. And we need this can also help us to understand more the drivers of antimicrobial resistance, and at the end to use them to improve policy and to set up actions to improve antimicrobial resistance. And another point that I wanted to mention is how to deal with upcoming resistance. How can also these indicators use to do it? And another point that I think is very important is how we, from one side, need standardization and harmonization between indicators, between sectors and within the sectors, to allow this comparison, this benchmarking, etc. But from the same time, we need flexibility on at country level, but also regional and global. So these are some challenges that we have when developing these indicators. And I see some organizations have proposed indicators, WHO, etc., etc. For example, in the one that I are more familiar is the European indicators. We have select indicators based on data that already was collected by member states. So and this is is indicators were derived from this data that was most focusing on antimicrobial consumption in humans, in food producing animals, and then in antimicrobial resistance in human and food producing animals also. And but what you see is that we need still more information, even in the European Union, that has a lot of experience in these questions on developing targets in the environment, in agriculture, and even in the food chain. So here is, I think, a lot of things to do to develop meaningful indicators. And just to mention about, that was also in the question, the word targets, that I think that targets are also an important topic to consider when looking at the research agenda, because from the experience from the Netherlands, for example, we had produced or set targets, just aspirational targets, not science-based, but develop just political targets, aspirational targets, like, for example, say the reduction of consumption of antimicrobials in animals in 5 years by 70%. That was not based on any scientific data, was just a political one. But here, just that we with experience that we have now, even this non-scientific base, or not based on scientific data, has helped the Netherlands to improve AMR policy. So in this context, it's something that we can, we think that is important to consider, even if we don't have this scientific based of evidence-based for these reduction targets. Thank you.
Thank you, Rosa. Yes, I thank you for this, because exactly, we have two things. So we agree that indicators is something that should be really established, very careful, and this is for countries, but also just focus on the research agenda. I think that is the opportunity to also help countries with the data to really, at least, to create more feasible indicators and also targets, as you mentioned. Is even when we have this knowledge gap, try to be to establish this target, inspirational target, as you said, but in some way considering that we need to fill this gap. So this is, I think, what is related with this research agenda. Thank you very much, Rosa. I will move, because we are out of time, with Joy. Thank you, Rosa. Joy, a second question for you is, what impacts can national and subnational policies have on AMR prevention, control, and response across One Health sectors, and how should they be measured? Over to you.
Thank you. I think this is not an easy answer, or an easy question, because there is no one answer. And I think for a policy to have impact and how to measure it is really situation and country and culture specific. And therefore, it's also really important, once you set up the research that's going to be the base for your policy, that you know the local situation and you work with the local, both policymakers and scientists. One of the other things I think is important is that you clarify or understand the impact of the research before you fund it or you start it. If you're the researcher, or you fund it if you're the funding body or the government or whoever pays for it. Because impact is many things. Impact can be a reduction in one specific antimicrobial use, but it can also be a behavioral change that may have other positive benefits. It could be if you take prophylactic antibiotics away in one of your animal production systems, you may actually end up with better husbandry. But of course, the policymakers need to think about that you will need some benefits to offer these farmers. And when you take away something they're used to having, something that's a good for them, you need to offer them something else so that you continue to work together towards a common goal. A lot of restrictions and legislation and things are good to a certain extent, but the more you push people, whether it's doctors, whether it's people who used to get antimicrobials over the counter, if you push people without giving them anything in return, you'll just end up with black markets, illegal imports and things. So from a policy perspective, it's not always the advantage to have really hard results or targets from research. You may just be looking for the behavioral changes towards something more positive. And I think it's important as well to remember that research is not necessarily looking at little genes or finding a technical solution. Research could also be testing whether it would make a difference that when a doctor is trying to prescribe a critical important antibiotic, the screen goes red, making the doctor think again, maybe I could use a less critical important antimicrobial in this case. Or it's all kind of these behavioral actions that we need to bring down the use of antimicrobials, to make all the people who work and use antimicrobials understand that it's a really important, and it's an asset to have antimicrobials. It's not a given and something we should just use like giving sweets to kids. We really need to think about how it's used, but it needs to be done in the hall. It needs to be done from the shrimp farmer to the specialist doctors at the other end. And any kind of intervention research that can help change that behavior, I think will have an impact. And policies supporting this is something to think about for the political level, that not just thinking in smart analytical methods and technical solutions, but also these behavioral changes are critical to have an impact for research.
Thank you. Thank you very much, Joy. It's interesting because exactly this research agenda is trying to cover exactly the 5 pillars that you are mentioning. It's not just the basic problem of bacteria and resistance and the spread and the places that is disseminating and circulating the resistance, but also behavioral change, also this policy that we are discussing today. So exactly this research agenda has the opportunity for countries not just to think to basic science about the problem, but also beyond that I think that we need to know more, and we will have this impact that I agree with you that needs to be defined impact to really measure. Thank you, Joy. I will move to Gada. Gada, the question is, what do you consider is an optimal financial resource strategy that will support One Health AMR interventions? Over to you.
Thank you. At the end of the day, we have to talk money, right? And financial mobilization, and there's no way around it. But I think we have to reflect that over the last 10 to 15 years, there have been funding for AMR, especially by development agency, international funders targeting low middle income country. And I think some funders more than others reflect on the impact of their funding and whether that actually advanced the research agenda in the country. But I think with the One Health research agenda, I think it's a good opportunity for us really to push this a little bit further. The research agenda is directed as well to funders and donor and global donors. And I think it's important that global donors, when they are looking at supporting certain areas, that this is really done in consultation with the countries where the research is going to be conducting. There's a lot of dialogue about, research agenda and who sets research agenda. And I think we need to encourage that dialogue more. Otherwise, I think it will deliver on the strategy and the mission of the donor, but less so on the country national action plan. And I think there is a risk here where the funding is a bit disjointed from what the country need, and it is driven by the donor's strategy. And this is where resource mobilization for impact is what we should start moving on. It's not only about having more money, it's what do you do with the money and whether that's actually impactful or not. And I would push it even further that for any sustainable change in country, I think many countries, especially middle income countries, can mobilize domestic funding. I think we cannot really be at mercy only of international donors. They can come and have a role to play, but I think the strategy of what is needed in the country should be set up by the countries, by the ministry, by the AMR coordinating committee, where they are sitting at the table and asking the donor, we need funding in this area, rather than be at the mercy of what actually the funders come and say, we want to fund this area. And I think that dialogue really need to be changed a little bit, where there is equitable voices by the recipient of the funding as well as the donor. And many countries really need to think about domestic funding. The agenda really kindly shows the AMR sensitive and AMR specific aspect of the research, whether it is IPC, whether it is WASH, whether it's surveillance, strengthening health system. These are cross-cutting issues, and AMR should start being more of a horizontal program rather than a vertical isolated program. And as such, we can mobilize funding from other challenges. It could be from universal health coverage, immunization, pandemic preparedness, etc. We cannot really think only as AMR, this isolated problem that a country need to allocate fund for, but more see what is specific for AMR and what's actually cross-cutting that you can mobilize existing resources. And I'm pleased that as part of the multi-stakeholder partnership platform, we are co-chairing an action group exactly on this, on resource mobilization for impact, reflecting and learning. And it's a bunch of research funding organizations that are there with ELMIC voices, reflecting on what has been supported over the last 10 years. Have we made an impact? And is it now time to think differently about how we do actually support this research work? And I hope Agenda will really invigorate that dialogue and really strengthen both the donor perspective as well as the recipient perspective to how research should be supported. Over to you.
Thank you very much, Gada. I capture and I will highlight these two big elements that you have to optimize the resources. We know that financially we need a lot of investments, but we need to optimize, definitely. And also the other that is a challenge in many countries is sustainability. But we are not going to create this sustainability if we are not creating first ownership, but also how to invest, because this will really is going to impact what countries are doing. And I agree that many of the things are already there, is to improve systems and not just focus on the problem, that the problem has been there, but we need to improve the system, that some activities are already there, but should be only improved. Thank you very much, Gada. I think that we are finishing this discussion panel. We have 2 minutes for a Q&A activities. If some of the participants has questions, please, now is the moment. It was a really rich discussion. Thank you to the panelists. I think that we don't have questions, so we can move to the closing remarks. I will give the floor to my colleague Francesca, and thank you again. Over to you, Francesca.
Thank you very much, Jorge, and thank you very much to all the panelists. I think that it was very rich, and then we learned quite a lot. I think that also for the different organizations that you also work with, and the different, well, region and countries in which you have been working and still supporting. So, well, as we were saying at the beginning, so this is the last for this series of the webinar, in which we were, the main aim was to disseminate more broadly the One Health Priority Research Agenda for AMR funding, and more specifically also going in details for the different pillars. We hope that we have triggered also your interest also to follow up for the next one that we are planning, as Elizabeth was mentioning, on having more a focus on the regional side, and also to engage even more with the donor. Just to sum up for today, I think that we have, it has been quite clear that for all the speakers that there is a need still to work together in the One Health spirit. I think that there are different countries that they already have mechanism, and it is important that this mechanism, it is established, well functioning, and I think that in the very true spirit of collaboration. So it's not possible that someone has a bigger voice than other, because I mean, if the topic has to be addressed in One Health, it is that also the funds, as Joy was saying, that they need to be shared among the different sectors. I think that we have also, I mean, it was very clear that it is very important to consider that when deciding to fund the research, to include the policy makers to understand the impact. So to understand whether, like, the activities that they are going to be funded, the research finding will be useful, and not only, and this was quite interesting, not only for the impact, but also to understand the specific stakeholders that need to be involved, whether they are actually willing to make the difference. Otherwise, maybe it is better to divert the fund in another situation. It's also, I think we heard quite a lot on the Codex Alimentarius, and then on the let's say the process on establishing a consensus-based code of practice, and also the surveillance. I think that there is a lot to learn. I think that it's in general it takes a lot of time to come together, and this comes back to the fact that it's really important to have collaboration on One Health established early on, because this will facilitate overall the thing. And also, I think that it was very clear also for GADA that it's very important to always take into consideration the economic aspect and also the behavioral science, because at the end, I mean, it's also our behavior that need to be changed in order to make an impact. And with this, I really would like to thank you all on the name of the quadripartite, and then really looking forward to see you for the next round of webinars, and also feel free to contact us to have more information. And in any case, you will find like this recording together with the other recording of the webinars in the Quadripartite Joint Secretariat AMR website. And thank you very much, and then looking forward to see you next time. Have a good rest of the day.
Thank you very much. Bye-bye.